Understanding hypertension, this is our area of discussion today. And if you are new here, kindly consider subscribing so that together we can move as a team. Talking of hypertension, when the World Health Organization, WHO, recently reported that over 1 in 3 adults globally have hypertension, I had to check my pulse. Then guess what? I checked my neighbors and thought, well, one of us is definitely guilt. But in all seriousness, hypertension has become such a global superstar and it's trending in more countries than TikTok. Today, let's find out why and more importantly, what we can do about it. This is Bwiri MedTalks. To begin with, what is hypertension? Hypertension, also known as high blood pressure, is a condition in which the force of the blood against the artery walls is consistently too high. Over time, this increased pressure can lead to serious health complications which include heart disease, stroke, and kidney problems. Blood pressure is measured in millimeters of mercury and recorded as two numbers. The top number, which is systolic, and the bottom number, which is diastolic. There are various blood pressure categories, and I'm going to give you these categories according to the standard guidelines. For the normal blood pressure, the values should be less than 120/80 millimeters of mercury. For elevated cases, systolic blood pressure should be 120 to 129, and diastolic should be less than 80 millimeters of mercury. For hypertension stage 1, systolic should be between 130 to 139, or diastolic should be between 80 to 89 millimeters of mercury. For hypertension stage 2, systolic should be 140 or higher, or diastolic 90 or higher. For hypertensive crisis, systolic should be over 108 and or diastolic should be over 120 millimeters of mercury. They usually say, what you don't know can't hurt you. But with hypertension, what you ignore can silently kill you. So before you talk about what causes this silent killer, let's understand the hidden forces that put us at risk, the causes and risk factors of high blood pressure. These causes can originate from lifestyle and genetic factors, which include unhealthy diet, that which is rich in salt and saturated fats, lack of physical activity, obesity or overweight, excessive use of alcohol or tobacco use, chronic stress, family history of high blood pressure. It may also be secondary to conditions like kidney or hormonal disorders. What are some of the symptoms and the silent nature of hypertension? You must have heard hypertension often called the silent killer, as I have mentioned before. This is the reason. Hypertension typically has no obvious symptoms until significant damage has occurred. When symptoms do appear, they may include headaches, shortness of breath, nosebleeds, or chest pain. But these are not always present and often appear when blood pressure is dangerously high. What are some of the complications of untreated hypertension? When the pressure builds and no one listens, something eventually bursts. Untreated hypertension is like a ticking time bomb, silent at first, but deadly in the end. Let's look at the serious complications it causes when left unmanaged. Number one, we have heart disease, which include heart attacks, heart failure, and left ventricular hypertrophy. Number two, we have stroke, which is due to weakened or blocked blood vessels in the brain. Number three, we have kidney damage, which results in chronic kidney disease or failure. And last but not least, we have cognitive issues such as memory loss, which may occur over time. Another very important part of our discussion is diagnosis and monitoring of hypertension. So hypertension is diagnosed by measuring blood pressure with a cuff device. Multiple readings, mostly 3 readings over time, are needed to confirm a diagnosis. Some people may require 24-hour ambulatory blood pressure monitoring. Regular monitoring is essential, especially for individuals who are at risk. Medications and medical management of hypertension. You see, when lifestyle changes are not enough, then medication may be prescribed. Common classes of antihypertensive drugs include diuretics, which are medicines that help reduce fluid buildup in the body, We have ACE inhibitors, also known as angiotensin converting enzymes inhibitors, that lower blood pressure. We also have calcium channel blockers that stop calcium from entering the cells of the heart and arteries. Lifestyle modifications for management of hypertension is a very key area of our discussion because lifestyle changes are often the first step in managing high blood pressure, and these changes include reducing salt intake and eating a balanced diet, heart health diet, like fruits, grains, fish. The list is endless. We have engaging in regular physical activity, at least 30 minutes in most days. Maintain a healthy weight, limit alcohol and avoid tobacco consumption, as well as managing stress through relaxation techniques or therapy such as CBT, which in full is cognitive behavioral therapy. And that brings us to the end. Remember, hypertension may be silent, but today we chose to speak up. Thank you for your time and attention. I'm now open to your questions, thoughts, or pressure relieving discussions you may have. Don't forget to subscribe, like, and share this presentation because awareness saves lives.